Hello, my name is Adesu Accessible and I'm going to be your nurse for today. I will do your head to toe assessment, but before I start, can you please tell me your name and date of birth?
Monica Chioma Amechi, October 5, 1966.
Okay, while she's saying that, I'm going to look at her armband to confirm if it's the right patient. Look at the medical room number and the medical records. Be sure this is the right patient. So, are you allergic to anything?
No.
Latex or glove? Okay, are you in any pain?
No.
Okay, do you need to empty your bladder before I start this assessment?
No.
Okay, so where are you?
I'm at home.
What's today's date?
Today's date is December 6, 2020.
Good. And who is the president of the United States
Donald
right now?
Trump.
Okay, so as the patient walked in, I assessed her physical appearance, I assessed her behavior, her gait was steady, her mood is okay. She walked, I didn't notice any abnormalities, her speech is clear and coherent. I don't see, her clothes are clean and she looks very, very hygienic. She's not in any distress and she's well nourished. So next I'm going to go to the head and I'm going to before I go to the head, I asked her if she was in any pain, but she said no. If she was in pain, I'm going to ask her to rate her pain level from 0 to 10. But pain level from 0 to 10. So next I'm going to go to the head and the face. So I'm going to check her scalp for any redness, for any lesion, swelling, or any molds. I don't see anything. Everything is symmetric. Have you had any problem with your scalp before,
No.
like any itching and all that?
No.
So her scalp and her hair is intact. I looked at her face for any irregular birthmark, lesion, swelling, or any discoloration. Everything looks okay. Her eyes are symmetry bioelectrically. Her nose is symmetry and her mouth is also symmetry. So the next thing I'm gonna do is to palpate the temporal lobe for any pain and tenderness. Do you feel any pain and tenderness?
No.
Okay, good. So I'm going to proceed to my cranial nerve and I'm going to start with cranial nerve 2. Cranial nerve 2, which is the optic nerve. I'm going to need my pen light and can you please look straight forward while I assess your optic nerve. I'm going to be assessing for pupil equal to round reactive to light and accommodation. So can you please look forward? I see pupil constriction. I'm going to go to the other part. A pupil constricted, so it means cranial nerve 2 isn't that. So the next nerve I'll be going to is cranial nerve 3, 4, and 6, which is the trochlea, oculomotor, and the abducens. And here I'll be assessing for the 6th cardinal field of gaze. So can you please look forward and just follow your follow this pen light with your eyes, just your eyes. So cranial nerve 3, 4, and 6 is intact. So the next one I'm going to be doing is going to be cranial nerve 5, which is the trigeminal nerve. So can you please clench your teeth for me while I assess the jaw? Do you feel any pain or tenderness?
No.
Okay, good. Cranial nerve 5 is intact. The next cranial nerve that I'll be assessing today is cranial nerve 7, which is the facial nerve. So can you please smile, frown, clench your teeth, puff your cheek. Okay, so that means cranial nerve 7, which is the facial nerve, is intact. The next nerve that I'm going to be doing is going to be cranial nerve 8, which is the acoustic nerve. So here I'll be performing the whisper test. So can you please occlude one of your ear for me? I'm going to say 3 words to you and please repeat it back to me.
4, 5, 6. Bag, dog, goat.
Good. So cranial nerve 8 is very intact. So the next cranial nerve that I'm going to be assessing is going to be the glossopharyngeal, and this is where I'm going to. Cranial nerve 9 going to be glossopharyngeal, and here I'm going to assess for gag reflex. So I'm going to ask her to swallow while I palpate thyroid. Can you please swallow for me? Do you feel any pain or tenderness?
No.
Okay, good. Cranial nerve 9 is intact. While cranial nerve 10 is the vagus nerve, I'm going to ask you to. I'm going to check for the uvula to be sure it's in the midline and not deviated. Can you please open your mouth for me? So the uvula is midline and it's not deviated. So cranial nerve 10 is intact. I was supposed to ask her to say ah when she opened her mouth. For cranial nerve 11, which is the spinal accessory, I'm going to ask her to um push up her shoulder against resistance. Okay, and can you please push your face towards, okay, and the other one. Okay, so cranial nerve 11, which is the spinal accessory, is intact. And the next cranial nerve that I will be assessing today is the cranial nerve 12, which is the hypoglossal. So can you please bring out your tongue, wiggle it to the side. Can you please say light,
Light, tight,
and dynamite?
and dynamite.
Okay, so when all the cranial nerves from 2 to 12 are all intact. The next thing I'm going to be assessing today is going to be the neck, and I'm going to start with the carotid pulse. For the carotid pulse, I'm going to palpate one at a time, so the patient doesn't pass out. So do you feel any pain or tenderness?
No,
Do you feel any pain or tenderness?
no.
Okay, and I'm going to assess for birth. Can you please take a deep breath and hold? Okay. Can you please take a deep breath and hold? Okay, so I didn't hear any birth, so our carotid pulse is intact. The next thing I'm going to be doing is going to be the lymph nodes, and I'm going to start with the preocular, which is right in front of the ear, the postauricular, which is right behind the ear, the occipital, which is right at the back, the mandibular, right here, and the submantle, right here. The superficial cervical should be right at the neck, right here, and the posterior cervical is right at the back. Do you feel any pain or tenderness?
No.
Okay, and the supraclavicular is right here. Do you feel any pain or tenderness?
No.
Okay, next I'm going to go to the thyroid gland. So can you please, I'm going to palpate first. Can you please swallow? Do you feel any pain or tenderness?
No.
Okay, then I'm going to auscultate and listen for birth. While I do this, can you please take a deep breath and swallow? Can you please take a deep breath and swallow? Okay, so I did not hear any birth in a thyroid, and when I palpated, I didn't feel any tenderness or any swelling. Then I'm going to assess for skin turgor, which is intact because I can't pinch much skin. Assessing for skin turgor is to check for dehydration. If I could pinch more skin, it means she's dehydrated. So that is intact. So next I'm going to be going to the breath sounds in the lungs, and I'm going to auscultate and listen for birth. So the first one is the bronchotrachea. Can you please take a deep breath and hold? Bronchiovascular. Take a deep breath and hold. Take a deep breath and hold. So for the bronchiovascular, I hear moderate pitch sound. For the bronchotrachea, it should be high pitch sound. And for the vesicular peripheral, take a deep breath and hold. I hear low pitch soft amplitude. So the next thing I'm going to be listening for is going to be the heart sound. And before I get there, I have to listen to the sounds at the back. So can you please take a deep breath and hold? Okay, everything looks intact. I didn't hear any brute or any or abnormal sound. So the next thing I'll be doing is to go to the heart sounds, and I'm going to start first for the I'm going to start with the aortic sound first, and I'm going to listen with both the bell and the diaphragm. So the aortic in the second intercostal space, right sternal border. Oh, just a moment. The aortic, the second intercostal space, right sternal border. The pulmonic, the second intercostal space, left sternal border. The Eppes point is in the third intercostal space, left sternal border. Tricuspid is in the fourth intercostal space, left sternal border, and the mitral is in the fifth intercostal space. Now I'm going to access for the apical pulse, which is in the fifth intercostal space, and I'm going to listen for 104 minutes. The S1 is at the base, while the S2 is at the apex of the heart. And I'm going to go to the upper extremities. I'm going to check our fingers for clubbing. I'm going to check for capillary refill. We should not be less than 2 seconds. We should be less than 2 seconds. I'm going to check for skin turgor. I'm going to check for can you please grasp my hand? Our muscle strength is really tight, and I'm going to check for a radial pulse and a brachial pulse, which is going to be a +2. I am going to access our lower extremities, check for clubbing, capillary refill, for skin turgor. Everything looks okay. I'm going to check, then I'm going to access a dorsalis pedis pulse and the posterior tibia pulse, which appear to be intact. Then next, I'm going to go to the female genital, the male genital. I'm going to verbalize that during the assessment there shouldn't be no discharge. The air should be distributed evenly. Urethra should be centered, and there should be no discharge. And for the female, I'm going to assess for odor, check for the air. I'm going to check for lesion, air distribution, odor, and no discharge should be noted. The inguinal nodes, those are located in the groin area, while the femoral is located just below the inguinal ligament, halfway between the pubis and anterior superior iliac crest. Then I'm going to ask my patient to come lie down so I can access her abdomen. And I'm going to start from the right lower quadrant. So I do not listen to any abnormal sound. I assess for the color of her stomach. It's clean and okay. There's no lesion, there's no tenderness. I'm going to do like my loud palpation. Please let me know if you feel any pain. Do you feel any pain or tenderness?
No.
Do you feel any pain or tenderness?
No.
You feel any pain or tenderness?
No.
So everything is intact. Then while leaving my patient's room, I'm going to put my patient in a comfortable position, put the side rails up, the call lights within reach, and I'm going to wash my hands and do my hand hygiene. Thank you.
Thank you.